First part of the chapter is going to be on diseases caused by gram-negative bacillus. And the first is not a disease at all, but again, an infection. And we're going to talk about burn infections. And when we're dealing with burn infections, we're talking about third-degree burns produced by either chemicals or physical burns. Now, understand a third-degree burn, the entire skin has been burned away. And believe it or not, it's painless when that happens. The pain comes when it heals. And the way the body heals this, because we've lost our biggest non-specific defense, is to form a very thick scab called an eschar over that area. Now, the organism we're going to focus on here is called Pseudomonas aeruginosa, and it's one we've worked with in lab. And this thing is a motile organism, and it can move by two different flagellar arrangements, monotrichous or lophotrichous. And this organism is a microaerophile, so it prefers to be in atmospheres of oxygen less than what we see normally in the atmosphere. So where it's going to grow is underneath the eschar, where the oxygen levels are lower. Now, where does it come from? It comes from two natural reservoirs, either fruits, but that's not the main one where we get it to the burn infection, but flowers are. And this is why, as a nurse, you can never allow flowers onto a burn ward, because by indirect contact, just things touching it or somebody mishandling it, it can get these organisms from the flowers into the eschar. And once that happens, we have a very serious problem. With the organism, we're going to see direct action as it grows underneath the eschar. Now, to take care of this, you're going to have to debride the wound, and we're going to have to physically take that eschar off, which is going to be excruciating. And then you're going to use antibiotics, both internal and external. The problem with the internal now is that the blood vessels have been burned away, so it's hard to get the antibiotics to the area that's been damaged. So we're going to have to use both topical as well as oral. Now, when we look at this, you will see the bacteria growing, because they will produce a nasty looking blue-green pus underneath the eschar. Now, here the eschar has been removed, but you can still see the pus left over. And here's a much more serious wound, much larger third-degree burn, and you can see all the blue-green pus forming. Now, again, this is going to have to be cleaned out, because if we don't just treat it with antibiotics, we're not going to get rid of the reservoir. So again, we have to remove the reservoir, and then brucellosis is a disease that goes by two other names. It's also known as Malta fever or undulant fever. It's called Malta fever because it's found commonly in the Mediterranean, especially in the islands of Sardinia and Sicily. And then it's called undulant fever because one of the big signs and symptoms. Now, as far as the organisms that produce this, there are two, Brucella abortus or Brucella suis. Now, both of these come from animal reservoirs, abortus from a cow, suis from pigs. So that makes this a zoonosis. Now, when we look at this disease, you can see the gram-negative bacillus. Now, they're a very short bacillus, and they almost look like they're round, but they are rods. And the transmission for this is going to be either indirect contact or vehicle. Now, primarily, we're going to see it vehicle unless we're dealing with farmers, then it will go with the contact. Now, as far as the pathogenesis goes, it's going to be by direct action at the site where we contact it, or when you ingest it, we're going to see it affecting the digestive system, and then moving from that spot, it can get into other organs, although it's really rare. What we see is this disease, just like a pattern we're witnessing all over the place, it only affects very young, very old, and immune compromised. Most adults that have a good functioning immune system, this disease is going to be self-limiting. It will take care of itself. Now, the one scary part is if it does move around, a pattern is going to develop starting with this disease that we'll see with all the other gram-negatives. Instead of using the blood, gram-negative bacteria, for whatever reason, like to use the lymphatic system. So this disease is going to move through the lymph nodes. When we look at this disease, the signs and symptoms are going to be where the other name comes in. We get an undulant fever, which means the fever is higher in the afternoon than at night. Now, that means you'll have 103, 104 in the afternoon, 101, 102 at night. Now, the other big sign and symptom is going to be a nasty rash that will develop at the site of either the contact, or if you ingest it, it'll be on the abdomen. And it, as you can see here, is this maculopapular rash, very obvious. Now, again, that's in people that actually get the disease. Most of the time, it's self-limiting, and you don't even know you've had it. Now, treatment's going to be antibiotics, and we need to treat this because if we don't, it can move and it can cause other problems. It can get into other organs, and it can also be a problem if you're a farmer going from you back to the animals, because it can be very dangerous to those animals. Complications of brucellosis are the following. If we're talking about cattle, Brucella abortus will cause spontaneous abortion in the cows because it grows on the placenta, and when it does that, it damages it to the point where the oxygen and nutrients can't be transported across, leading to the death of the fetus. So it will be aborted. Now, that's in cows. Now, in pigs, we'll see what's called orchitis. This is inflammation of the testes. So this happens in the males, and the testes will swell up. They will actually become cut off from blood flow and necrotic and have to be removed, which makes the male sterile. So that means if you're raising pigs and cows, this organism can be very dangerous to your animals. However, in human males, we can see the same thing. So that's why we do want to treat this disease when it shows up. We don't just say, well, it's minor, let it run its course, because it can move to other organs and it can be dangerous. So we do need to treat it. The next disease we look at is called tularemia. Now this one has kind of a joke name to it when you see it. We commonly call it rabbit fever, but it is no joke. This is one of the most deadly diseases on the planet. When we look at tularemia, the causative agent is a bacterium called Francisella tularensis, a very short gram-negative rod, as you can see here. Now this organism has been used in biological warfare. It is that dangerous. Now, when we look at the epidemiology, the transmission, it's going to be by contact. Now, that contact is going to be either direct or indirect, and it depends on how you obtain it. Is it from the skin of the animal, where it might be from you combing through the animal's skin and getting the organisms on you? It could be from wearing gloves and taking them off incorrectly and getting it onto your skin that way, or it could be direct horizontal contact where you get a bite. Now, primarily, the reservoir for this is going to be a rodent, and the rodent is a rabbit, and you can see diseased rabbits. Now, when they are diseased, they will have these sores on their bodies, which are very visible on the belly side, which is white fur. And that's why hunters that kill rabbits will tell you, if you see any of these diseased rabbits and you've shot them, you do not touch them, because any touch can transmit this disease. And if people raise rabbits, they have to be aware of this, because once this disease gets in the rabbit population, they're going to have to be destroyed, or else they'll pass it on to you. Now, the other thing to note here is that in Calhoun and Macoupin counties, we do get incidents of this disease. So this is something we will see in this area. Now, the other big way to transmit this is by way of a vector, and the vector is a tick. But the tick happens to be, as you see here, a dog tick. So if you let your dogs go outside and they'll pick up these ticks, you've got to make sure you go through their fur and get rid of them, because they can go from the dog to you, and one bite and you'll have this organism. When we look at this disease and the pathogenesis, it'll be direct action, but you're going to see some really noticeable signs and symptoms from the passage. So when we see this direct action, if it's from a contact, it'll be an open, painful lesion at the site of the contact, which will come in through a microscopic break in the skin. If it's a bite, it forms kind of what we call a papilloma, kind of a nipple-like appearance. And you can see what I'm talking about here. Here's the ulceration at the contact site through broken skin, and here we see it through a bite. Now, at this point, the organisms are going to go into the bloodstream and get into the lymphatic system. They'll go through the blood because that's what they have access to, but they don't stay there. They want to get into the lymphatic system. And as they do that, and they enter the lymph nodes, they form what's called a bubo. Now, this is something we're going to talk about in other diseases, but we see the swelling of a lymph node nearest the site of the bite or contact. So if it was on the hand, it'll be in the armpit. If it would be on the face, it would be in the neck that we would see this bubo. If it would be on the leg, we would see it in the groin, because that's where we find the lymph nodes. Now, at this point, what we're going to see the organisms do now is move. And when they move, they go to the lungs, and that's where this disease is fatal, and it also gives us another means of transmission. Now you can see here the abscess that's formed in this lung of somebody that's died from it. It just eats right through the lung. The problem is now one cough and you can spread it through indirect contact via aerosols. So that also becomes an issue. Now, one big sign and symptom when you get an abscess is similar to what we talked about with tuberculosis. You will get hemoptysis, where you cough up blood. So absorb all this information, because as I said, this is something we actually see within this region. Whooping cough is a disease, no pun intended, where the bark is worse than the bite. It's caused by Bordetella pertussis, and that's why commonly we call the disease pertussis. And the P is part of the DPT vaccine, which we've already discussed, being a preventative used for diphtheria and tetanus, as well as whooping cough. Now, the vaccine is made out of this organism because it is the weakest of the three. As I said, it sounds worse than it really is. Transmission is going to be indirect contact through aerosols. You'll inhale the organisms, but the pathogenesis is going to be a toxin, and that's what they release. Now, we are going to treat this with antibiotics, but only for a couple of days, just to make sure we get rid of all the bacteria. After that, you have to treat the signs and symptoms, which we will see here. Now, the signs and symptoms are going to depend on the stage of disease, and you're going to see a difference in the names that we provide for the stages, and that's because this disease and the stages that were given for it predated what we've learned in chapter 14 with the current stages of disease, but you will see a parallel. Now, the stages are the catarrhal, paroxysmal, and convalescence. Now, the catarrhal stage is where we get the nonspecific signs and symptoms. You ache, you're tired, you just don't feel right. Okay, very similar to the prodromal phase that we talked about in chapter 16. From there, we go into the specific signs and symptoms, where here, the paroxysmal stage, we will see the periodic episodes of this horrendous whooping cough. Now, this whooping cough, these episodes will go on for almost a year, sometimes even a little longer. And people will go for 30, 40 minutes of just constant coughing. My sister had this disease, and she would cough so much that she would turn blue and pass out. So it's a nasty cough, but the good news is it's not damaging to the body unless they break something, and it can happen because it's such a violent cough that you will often see broken blood vessels in the eyes, and you can see those here, and sometimes it can even break ribs. Now, the paroxysmal stage parallels with the invasive stage because we're seeing specific signs and symptoms, and as I said, this can continue for a year. Now, we'll treat with antibiotics, but only for a couple of days, and then what we'll have to do is treat the signs and symptoms, which is the cough, and we do that in today's world by using a nebulizer with albuterol. That will help to alleviate the inflamed airway, and that's what that toxin does. It inflames the airway. So that's why you can't take a cough syrup. It's not going to do anything for this. You need to take down that inflammation. Now, once we get through the cough, now the convalescence period will come in, which can take as long as 6 months to a year. And even after you heal, you may be prone to asthma for the rest of your life. Now, again, the way we try to treat this is to prevent it with the DPT vaccine, okay? Because as I said, antibiotics just for a couple of days once you get the disease, and a nebulizer from that point, we want to prevent it. The DPT vaccine is what we're going to use. And this vaccine is one that is injected into you, and it is a toxoid. It resembles the toxin of the three diseases. Intestinal tract disease with gram-negatives, we also see different terminology, but it relates to terminology that we've used in chapter 14. Instead of saying direct action and toxin production in regard to these diseases, we have some terminology that predated that, and what we will use is infection and intoxication. Now, an infection is direct action, so the bacteria will be present, it will be multiplying, just as we've talked about. In intoxication, this will be a toxin. Now, when a toxin is produced in the digestive system and it produces disease, we tend to use the word poisoning to describe it. So keep that in mind. So when we say food poisoning, it's implying that a toxin is being involved. With direct action, again, the tissue is going to be invaded. Now, when we're dealing with the toxins, understand what they're going to be doing is changing motility. And that is going to alter peristalsis, either make it hyperperistalsis or hypoperistalsis, either way. So by going too fast or too slow, what we see now is a problem with water being reabsorbed. And that's going to lead us to the signs and symptoms. Now, with infection, direct action, the big sign and symptom when tissue is invaded is going to be dysentery. Whereas over with intoxication, the big sign and symptom because of this loss of motility is going to be diarrhea. Now, these two terms are not remotely related. When we look at dysentery, we're talking about severe abdominal pain, and this will hurt before, during, and after you defecate. We will see blood and mucus in the fecal matter. Now, when we look at diarrhea, it's loose, watery stool. You'll get some cramping, okay, but that cramping will go away once you defecate. And this loose watery stool is because we're not reabsorbing water and we've got a lot of fluid. Now, dysentery is bad because we're seeing the tissue being destroyed, but diarrhea can be just as dangerous. Diarrhea is the #4 cause of death in children worldwide. So understand, fluid loss like to this level can be very serious. The first digestive tract diseases are going to be caused by E. coli, and there are 2 of them. Now, one is much more mild than the other. The first one is going to be an intoxication, and it happens because human E. coli throughout the world is not the same. Now, when we get that E. coli from different areas of the world, it won't kill us, but it often makes us sick while we're adjusting to it. And that happens when we travel, hence the name traveler's diarrhea. Now, looking here on this map, you can see various areas of the world where you can develop traveler's diarrhea. Note the spelling of diarrhea here. This is the English spelling. Now, the disease is going to be due to an enterotoxin, and this is an exotoxin. It's going to be released, change the motility of the gut. And when it does, we'll have diarrhea as the big sign and symptom. Now, when we look at this and you see on the map, Mexico is primarily a big area of red, and that's where a lot of us travel. And that's why you're told when you go there, do not drink the water, do not eat ice, and do not eat food off the street. Because if you do those things, you're going to get this toxin. Now, again, that's because the E. coli there is different from the E. coli that we're used to in Godfrey, Illinois. Now, if you stayed there for any amount of time, it would go away. Your body would adapt to it. But we're only there for a week. You don't want to be in the bathroom for the week. So keep that in mind. Now, with this disease, we're going to treat it with antibiotics just to make sure we get rid of it, okay? But the big thing is to treat the diarrhea. And as I said, it will go away if you stay there long enough. Now, the same thing happens when Mexicans come up here. They'll get the same kind of thing. Now, we also see it when we travel around the country, but not nearly to this level. If you've ever traveled all the way across to the East Coast or West Coast, when you get there, you may feel the next day a little nauseous, a little tired. That's because and by the way, they call that jet lag. Well, we're finding out now that it's because you're adjusting to the E. coli. But it's not that much different than what we have in the Midwest, so you adapt very quickly. It only takes a day or so. Whereas here with traveler's diarrhea, it's going to be much more. Now, there are exceptions. We can get forms of E. coli that are very nasty, but that would be from someone that has picked up the next type of E. coli in an infection and then passes it on. Now, in an infection, this is the serious one because this is going to come from animals other than humans. It's going to be direct action because it's an infection, and it's going to be what we see in different sources from meat to vegetables to fruits. Now, when we look at this, what happens is E. coli is going to come from an animal source into these foods, okay? And when it does, it's going to get into the gut, and it is enteroinvasive, which means it invades the intestinal tract and it destroys it. And as it goes through the small intestine, it gets into the peritoneum, can cause peritonitis, and that has a 30% mortality rate. Some of these can even produce a toxin, and that toxin can cause blood vessels to burst. So even though that's rare, the infection is much more something we'll see much more often, but there is a chance for this toxin as well. Now, how does it come about? Well, in the case of meat, if anybody here is a deer hunter, you know that you have to field dress a deer, which means to remove the digestive system after you kill it. But if you're in the process of doing that, if you open the colon and the colon leaks out onto the meat, you know not to use the meat because at that point it's contaminated. Well, when companies butcher cattle, that same thing can happen. But the problem is they don't want to lose the money. So often they'll just grind it up inside the hamburger. And with the hamburger, you can keep from getting sick by cooking it well done. But if you're going to keep it red in the middle, we got a problem. Now remember, these are all gram-negative bacteria. So every disease in this chapter, remember, can be eliminated with heat because these cannot form endospores. But you've got to cook it well done. If you're going to keep it red in the middle, then you're going to run the risk of getting sick. The same thing applies to the other things that you see here. When we looked at the spinach, 7 years ago, we had an issue in California where wild pigs got into a field of spinach and defecated on the plants. Now, the spinach was packaged and sent to people. If they cooked it, not an issue. But a lot of people put spinach in salad, and you don't cook it. Now, I've heard people say, well, that's why you have to wash your vegetables. Well, it will do no good because E. coli, when it is enteroinvasive, is going to use attachment pili, and it will hold on to these. So rinsing it with water is not going to get it off the leaf. Understand that. So this becomes very serious. And now when you eat that spinach, these bacteria get into the gut, and now they can easily invade and destroy your digestive system. Now that's a real problem when we're looking at organic foods, because if we process foods, that doesn't happen. For example, with the apples, a few years ago, we had an issue in Washington State where apples had fallen on the ground. Cows were eating them, and defecate from the cows was getting onto other apples. Well, the farmers didn't want to lose their money, so they picked those apples up, sent them off to be processed into juice. Now, if it was processed by pasteurization, not an issue, because the pasteurization removed the organisms, no disease. But if it is organic, that's not done. So they were pressed and juiced, and the juice contained these bacteria. Kids drank it, and kids got sick, and some died because it's that dangerous. Remember, it's going to produce severe dysentery. Now, treatment with this is going to be antibiotics, but we have to get them in to a different opening, so we use a suppository. And that's important that when you're, if you ever have to insert a suppository, it has to go past the anal sphincter. You have to make sure it goes deep. Now, one other thing about E. coli, it's very important. This is one of the big causes of urinary tract infections, especially in women. Men just don't get urinary tract infections unless they're very old, and if they do get them, it usually indicates that they were transmitted sexually. Now, with women, the bacteria, which is very motile, E. coli can move. They're going to come from the anus, and they're going to get into the urinary tract. Now, the thing about these bacteria, when they're in your gut, they don't hurt you. In normal flora, most of your gut is E. coli, and we need it because E. coli does two major things. Number one, it breaks down undigestible fiber, and it produces gas so you can defecate without screaming, so you're not constipated. Second, it produces the bulk of the vitamin K that you have in your body. We get very little from diet. E. coli produces the bulk of it. So we have to have human E. coli, and if it stays in the gut, it's perfect. But if it moves, we have a problem. And that's the thing with all normal flora. When they're in their normal location, they're great. But if they move, now they can become pathogenic. And that's what happens here. When it moves from the digestive tract, from the anus to the opening, which is very close, which is the urinary meatus, it now gets into the urethra. And women have a very short urethra. So ladies, if you're not urinating enough and rinsing this out, the bacteria moves up through the urethra, you develop urethritis, and then it goes into the bladder where you develop cystitis or worse. Now, this can happen especially with young girls when they don't know how to wipe correctly after going to the bathroom. So they have to be taught. The other thing is sexual practice. You have to be very careful if you're going to utilize certain sexual practices like anal sex, because then bacteria from the anus can be deposited into the opening. So keep that in mind. And again, that's how many men get it. One other nasty little side thing, if we see this happening a lot in young women, that may mean sexual abuse. So that's one of the things that caseworkers look for. The next disease we talk about is salmonellosis. Now, some of you have heard of salmonella food poisoning. Well, there is no such thing. Salmonellosis is not a poisoning. Now, the etiological agent for this is any species of salmonella, and that's unique. Most of the time, you'll see within any genus, some species pathogens, some not. We saw that with Staphylococcus. Aureus is the pathogen, Epidermidis is not. But in Salmonella, everything is pathogenic. Now, some are more virulent than others. That's why your book says something that I really don't agree with. It says you don't really need to treat this with antibiotics. Well, you do, because if you get some of the milder virulent forms, yeah, you can get over it pretty easy. But if they're not, it can be fatal. We should always treat this with antibiotics, and you'll want to if you get it, because the signs and symptoms are so severe. This organism you can see here, gram-negative rods. The transmission is going to be by vehicle, okay? Or it can also be by contact, depending on what it's from. Now, vehicle will be from poultry. Now, that will be looking at chickens and turkeys, and then we're talking about their eggs and their meat. Okay, we'll naturally find it in eggs, and that's why eggs should always be cooked. We never want to eat them raw. We don't want to put eggs into cookie dough or cookie batter or cake batter and eat it before it's cooked, because especially if these eggs are left out, because some people don't store their eggs in the refrigerator, which you don't have to. And when you do that, the bacteria can grow. And now they'll be more abundant and they can be present in the batter or the dough. So you want to cook it first. Remember, they're gram negative, they have no protection. We can also see it in the meat of chicken and turkeys. That's why that meat has to be cooked well done. If you're buying, let's say, chicken wings and you bite into one and it's still red in the middle, you don't want to eat that because it could contain bacteria. Now, this can also be transmitted by contact, and that contact will be with reptiles. Now, a lot of parents like to use reptiles for pets because they are low maintenance pets. They don't have to be fed a lot. They're real easy to take care of for kids. The problem is that this is naturally found in their fecal matter and under the claws of some lizards. So anytime these children take care of these animals, they need to wear gloves when they're cleaning the feces up, and they definitely need to wash their hands when they're done, and they have to be careful if they get clawed because that could transmit this. The pathogenesis, this is an infection, so we're going to see direct action, and it is highly invasive, as we saw with E. coli. And you can see here what it's doing to the villi. You see all those little black dots? That's necrosis. It's eating right through it. And as it goes through, the peritoneum's next. We will also see this organism moving to other organs, and one of the organs it likes to go to is the gallbladder, which we'll get to in a moment. Now, with this, the big sign and symptom is going to be dysentery, and you can see that here. You can see in the person, and by the way, both of these intestines are from someone that has died from this disease. You can see on the one on the right here, the black defecate. That's how you know there's blood in the feces. Because when fecal matter is pitch black, that's what we call tarry, then you know it. You can also see the mucus that's building up here. So this is a really nasty disease, and it is highly invasive, and it can be fatal, unlike what your book says. Now, when we're looking at the treatment here, we're going to treat with antibiotics, okay? And we've got to make sure that you're going to take these for the full time. And believe me, you'll want to, because dysentery is awful. I got this disease from a Denny's restaurant years ago when my mom and dad and I had gone down to Oklahoma City to visit my brother. My niece, my oldest niece, who is now 26, was getting christened. And we went to that, and on the way back, we stopped in Tulsa to eat breakfast, and we wanted to go on the road quick, so I got biscuits and gravy. I got home later that day, wasn't feeling real good by that night, and there was a phone call that said, "This is the Oklahoma Public Health Department. Have you or any of your family eaten at the Denny's restaurant in Tulsa?" And I went, "Yes." "Did anybody eat the biscuits and gravy?" "Yes, I did." "Well, you can expect to be violently ill in the next few hours," and I was. And folks, when you get dysentery, it's awful. The pain is unbelievable. It hurts so much you're in the fetal position. And antibiotics, it took 3 days before they started working. So understand this is serious. Now, one other thing about salmonellosis. The signs and symptoms appear, like I said, usually around 8 hours after you eat. But there's another disease that we want to talk about. It's one we mentioned in lab, and that's staphylococcal food poisoning. These two, salmonellosis and staphylococcal food poisoning, are two of the most abundant diseases when it comes to cookouts. Now, we're going to have cookouts coming up this summer, and think about the foods that people bring to a cookout. They bring potato salad, and it's going to have salt in it, which staff loves. But there's also eggs, and there's mayonnaise, which we see salmonella being a part of. And when those foods are sitting out in the hot sun, the bacteria start to grow. And now when you eat them, you get mouthfuls of salmonella or mouthfuls of the staphylococcal enterotoxin. And that's why we can see these two being very common. Now, to keep that from happening, number one, food shouldn't be left out, okay, especially if it's a hot day. Number two, don't let people touch the food, because if they're touching the food, they're putting bacteria into it where it can grow. And that's a real problem if these outdoor doings are at public parks where there's not places to wash hands. Okay. The third thing is we got to make sure that when we're at these places that we are going to the bathroom and washing our hands or using a hand sanitizer to keep that transmission from happening. Because remember, the types of food, the temperature, and people touching, all three of those things will lead to disease. Now, some people can become a passive carrier with this organism as it moves into the gallbladder. And that means that anytime they defecate, the bacteria will be in it. So you have to wash your hands, because if you don't, anything you touch will contain it. And if you're making food or you're a cook, that's a real issue. Typhoid fever is the most serious form of salmonellosis. It is caused by either Salmonella typhi or Salmonella typhimurium. Now, typhi is the one we see most often. Now, with this disease, it is still direct action, but the transmission now is going to be vehicle, and we're going to see this becoming systemic. So you're going to ingest it. We're going to see the direct action, so it's an infection, and now we're going to see it spread. And the big sign and symptom is going to be a really high fever starting at 104. And back in the 1800s, that's what made this fatal, because we couldn't handle fever. So when people got this high fever and it kept going up, it usually killed them. Following that, we're going to see a nasty rash that will originate on the abdomen as these big blotches, and it will start spreading all over the body, as you can see here. Okay. Now, this disease has to be treated with antibiotics, but even then, it will often make its way to the gallbladder, and people once again can become reservoirs for this disease. And a good example of this was a passive carer named Typhoid Mary Mallon, she was a cook, and in the early 1900s, she caused at least 6 outbreaks of typhoid fever. And what they did to stop her was they declared her mentally incompetent and put her into an insane asylum. Shigellosis is the most serious of all enteric disease, because this is what I call the triple-edged sword. Now, with E. coli, I did tell you that sometimes when it's enteroinvasive, it can produce a toxin, but it doesn't happen very often. That's not the case here. Now, the organism that causes bacillary dysentery, and this was a disease that killed a lot of our POWs in World War II, in Japan, in Korea, and in Vietnam. The causative agent is called Shigella dysenteriae, and with that name you can see it's going to produce serious dysentery. Now, the transmission is going to be indirect contact or vehicle, but it's going to involve animals once again. So indirect contact could be from handling their fecal matter, not washing their hands. Vehicle could be drinking water that they've infected, or by eating undercooked meat. So once again, we're seeing a zoonosis. Now, this is a really harsh pathogenesis because it is an infection. The bacteria are highly invasive, but it also is an intoxication. It produces a toxin at the same time. So we're going to see, for our signs and symptoms, we're going to see both dysentery and diarrhea. Then you throw in the fact that this is gram-negative, which means it could always release an endotoxin, and now you see why I call it the triple-edged sword. It can do all 3 modes of disease production, and that's why this thing is so dangerous. Now, when it comes to the signs and symptoms, we don't focus on the diarrhea, we focus on the dysentery because it's more serious, but diarrhea is going to happen right with it. So there's going to be tissue being broken down, so we're going to see blood and mucus, but you're going to see a lot of fluid too. And when you look at these pictures, you can see what I mean by this organism being highly invasive. You can see it eating right through the intestinal walls. That will get into the peritoneum again. Peritonitis will ensue, which is fatal. But we also will see a lot of moisture. Look at all the water you see here because we're lacking that motility. So we're getting dysentery and diarrhea simultaneously. Now, one thing about dysentery that I didn't mention before, it is extremely forceful. When you go to the bathroom, it explodes out of you and it hurts. It hurts so bad you can't stand it. So understand that this is a very serious disease. Now, treatment, we're going to have to use antibiotics, no doubt. But one of the things we have to do is try to prevent this from being spread. Now, we did have an outbreak of this a few years back. Oh, it's going on almost 10 to 15 years now at Beverly Farms. There they had, at one time, a petting zoo. And you got to remember that the people that run the place are mentally challenged. And some of them would forget to do things like wash their hands after cleaning up after the animals. And then they would go in and work in other areas. And sometimes that would be the kitchen. And they would contaminate food. And there was an outbreak of shigellosis. Luckily, no one died because one of the lab workers was able to identify it really quick because she had taken her grandson out there to the petting zoo. And when they recognized that these samples were coming from there, she tested for this organism, found out what it was, so they could get proper treatment right away. Pneumonia is something we've already discussed. We've gone through the signs and symptoms, and we've already hit 2 organisms that have produced it. Now we're going to get 2 more. Now, the first type of pneumonia we're going to deal with is called Legionnaire's disease. Now, this is caused by an organism called Legionella pneumophila. It is a mesophile, but it's a high-end mesophile. It likes up to it will grow at 39 to 40 degrees as its optimum temperature, but it can have a maximum growth temperature all the way up to 45 degrees Celsius. So it can handle very high temperatures. Now, when we look at this disease, the transmission is going to be by vehicle. Now, it's aerosols, but from a mechanical device. And you can see that here. So we're talking about things like air conditioner units, which should register to the last test. We're talking about things like hot tubs. We're talking about things like misters at amusement parks. And because of that, all of those have to be treated with chemicals to keep these bacteria from growing. Now, this disease first came across in 1974 at the American Legion National Convention in Philadelphia. The pathogenesis is direct action, just as all pneumonia is, and it's going to produce the same signs and symptoms. So we're going to see it destroying the lung, but that's not the big problem here. The big problem is going to be in the sign and symptom, and that first sign and symptom is high fever, which starts at 105 degrees Fahrenheit and keeps going up. Now, why? Let's go through this. The organism is in the water supply that we use to cool the air in an air conditioning system. Now, in 1974, that was one of the first years that we had central air conditioning units, and these reservoirs are kept up on the roof of the buildings. Well, it was thought to be so hot up there that it would kill all the bacteria that would produce disease, because that temperature was getting up to 40 to 45 degrees Celsius, which is extremely hot. 120 degrees, that's hot. And it was killing, we thought it would kill all the bacteria. Well, it did most except for Legionella. And this organism thrived in it. Now, when hot air from the building was run through that water to cool it off, these bacteria were picked up, and now they were pumped into the building, and now people inhaled them. They got into the lungs, and they started this disease. Now, the fever starts at 105 because we have to crank up the heat that high to try to denature the proteins to kill the bacteria. But these bacteria aren't killed by that temperature. So the body raises it again and again to the point where our fever is going up so high it's killing us. So we still have to deal with the other signs and symptoms, but if we can't handle this fever, you're going to die before those other things even are addressed. Now, that's why when we look at this, we're going to treat with antibiotics, but you have to control the fever. And that's why the mortality rate is ridiculously high. It's a 50-50 shot. So understand how serious this disease is. The next form of pneumonia is just as bad as what we previously talked about. This one is caused by Klebsiella pneumonia, which is an organism we've worked with in the laboratory. So like Streptococcus pneumoniae, this one too has a capsule, okay? But with this one, we're going to see a higher mortality rate than what we saw with Streptococcus. The signs and symptoms are going to be identical, but where it comes from, okay, and the mortality rate are what make this more dangerous. Now again, with the capsule, that means the phagocytic cells are going to have a very difficult time trying to remove that. So once this thing gains entry to the lungs, it can be dangerous. Now when we look at this organism, the transmission is going to be by indirect contact. You're going to be coughing it out. So aerosols are how you get it. But it's also part of the normal flora of your gut. Okay, and again, once it's in the gut, it doesn't hurt you, but if it gets from the gut to the lungs, it can be dangerous. So this can be an opportunist, and I'll explain to you how it gets there. Now, if it's something you inhale, it doesn't normally affect people with good immune systems. But if somebody has a malfunction in the immune system, they're immune compromised in some way, then getting this disease is something that can occur, and it would be indicative of those immune problems. I had a colleague that got this disease, and they couldn't figure out why this person would get it, and lo and behold, it's because the person also had cancer. They just didn't know it. So this disease was able to get in because their immune system was not functioning properly. Pathogenesis will be direct action, as all pneumonia is, and we will see the same signs and symptoms as we saw with strep. The difference is with this, the mortality rate is higher. Now we'll get into why. Now with this mortality rate, as you can see, 15 to 20%. And the reason for that is because of who it affects. First, immune compromised. Okay, that's what it goes after. Second is when it's an opportunist. What it affects are people that are intravenous drug users or alcoholics. And that's how it gets from the gut to the lungs. Now, folks, you may not realize this, but when somebody's an alcoholic, they have a real problem trying to control their defecate. Alcohol affects the muscles, and they lose control of their anal sphincter, and they will defecate all over themselves. And they roll around in it. These bacteria that are in the fecal matter, they inhale them, get into the lungs, because their immune system is already compromised. Same thing with intravenous drug users. When they're shooting up, they lose control of their sphincter. when I was a senior in college, I was doing my my senior thesis on transmission of this organism. I went around with a friend of mine who was a parole officer, and we went into a drug den, and the smell was unbelievable because of all the fecal matter everywhere. And you realize how dangerous this organism is because of that. And again, they would roll around, they would inhale this, their immune system's already depressed, and now this organism's in their lungs, and it's fatal. Bubonic plague was this disease that wiped out most of the population of Europe back in the Middle Ages. And it's the one that's still around today. And remember, we talked about this being endemic in the Southwest United States. Now, the etiological agent is called Yersinia pestis, again, a gram-negative rod, but the epidemiology is by vector. Now, the vector is a rat flea, and you can see what it looks like right here. The reservoirs are rats, and what happens is the flea bites the rat, and then it jumps onto a human and bites you, and it transmits the disease. So we need to keep the rat population low too. Now that's why we still see this disease in other countries where rats run abundant, especially in India where they won't kill other animals because of their beliefs in reincarnation. Now when we look at this disease, because of this, it will be a zoonosis. And that's how it was transmitted to some of the Boy Scouts that got this disease a couple of years ago down in New Mexico. They were camping out in the desert. There was an abundance of rats running around. Fleas from the rats got onto the boys while they were sleeping and bit them, and a few of them got this disease. Luckily, people recognized it for what it was and treated it, because if you treat it in this bubonic form with antibiotics, which were not available back in the Middle Ages, it will respond. Now, the pathogenesis is direct action. We're going to see the flea bite. We're now going to see this thing getting into the blood, going into the lymph nodes, just as we saw before with rabbit fever. Now, once it's there, we're going to see the formation of a bubo, okay? And that sign and symptom is the key. And you'll see it right here. So if you're bitten on the leg, we'll see it at the groin. Now, the problem is, if you don't treat it at this point, we're going to have some serious complications. Now, even here, the mortality rate can be high, 25% on some cases. So keep that in mind, that if you don't treat it right away, the mortality rate's still high, but not as high as you would think from a disease that wiped out most of the population back in the Middle Ages. Now, the big issue here is this organism is highly invasive, and it's going to spread. And you can see here on this bubo, the black color, that's necrosis. And that's the big issue here. This thing invades other tissue and it starts to destroy that tissue, and necrosis will ensue. Now, we have to treat this with antibiotics, but you have to treat it before it begins to spread. Once bubonic plague spreads, we're going to see two forms, and both are extremely dangerous. The first complication is what we call systemic plague. Now, it's going to move from the bubo to the rest of the body, and what we're going to see is severe necrosis all over the body. So any organ it comes in contact, and you can't cut off everything. And that's why with systemic plague, the mortality rate is 100%, even if you treat it. So we have to stop this disease before it spreads. The other complication is pneumonic plague. Now, with pneumonic plague, it gets into the lungs. Now, systemic plague we referred to as the Black Death because we would see it all over the skin. Pneumonic plague you can't see, but you can see the signs and symptoms as people are coughing, and you will see necrosis in other areas. It is highly destructive to the lung tissue, and you can really see that with this shot. It almost looks like somebody shot the lung with a shotgun. But the big issue, besides the fact that it has a 100% mortality rate, is that now when somebody coughs, it can be spread by indirect contact. So this is an extremely dangerous organism. Haemophilus influenza is a gram-negative rod that we see primarily causing diseases in children. Now, it got its name because back in the 1920s when we had the influenza outbreak, doing samples from people that had the disease, this organism was found in the sputum. So originally they thought this was the cause of that outbreak, and we found out later it wasn't. But the name held up. Now, it causes a variety of diseases in children, but we see as adults we never get it. Now, the hypothesis is that Haemophilus, there's only a few variations of it. When we talk about Streptococcus pyogenes, the cause of strep throat, I told you there were 55 different forms. That's not the case here. So with Haemophilus, since there are very few, we can develop memory to all of these as we get them, and so as we reach adulthood, we no longer get sick from them. Now, here are the diseases they can produce. Conjunctivitis is inflammation of the conjunctiva, also known as pink eye. Pharyngitis is a sore throat. Now, with pharyngitis, it will also produce lesions just like strep. So that's why we have to test to know which one it is so we can use the appropriate antibiotic. In kids, it also produces middle ear infection. The bacteria will move from the throat via the eustachian tube to the ear, and we'll see that middle ear infection. Now, the American Pediatric Society says no longer should we be giving children with ear infections antibiotics at all. We should let them run, and if they continue, then we put in the drains to drain off the bacteria, and that will stop the ear infections. Now, the more serious is epiglottitis and pneumonia. Epiglottitis is inflammation of the epiglottis. That's the tissue that covers the trachea when you swallow. If this gets inflamed, it will cover the trachea and you won't be able to breathe, and that will suffocate you. Pneumonia, hey, we know how serious that is, and we're going to see the same signs and symptoms as the others. So here's our fifth cause of pneumonia, but this will primarily be in kids. So we're going to see the bacterial signs and symptoms: fever, productive cough, severe pain. Now, the worst of all is meningitis. Now here, the inflammation is not of the brain, but of the connective tissue surrounding it. It will swell up, put pressure on the brain, not allowing it to function. And that is going to be fatal. Now, with this disease, primarily we're going to see it is in children under 5, and it's a real problem in daycare because it can be spread through these kids. So luckily there is a vaccination for this, and I do recommend that if you have kids that are going to be using daycare, that they should get this vaccination. Now, as far as the organism goes, it's part of the normal flora of the upper respiratory tract, but it is an opportunist. So it's in very small numbers. They have to increase to make you sick. They have to move into these other areas to make you sick, so keep that in mind. And again, as you reach adulthood, we tend to develop memory to all of these. Chancroid is a disease that's a cousin of Haemophilus influenza. This one is caused by Haemophilus ducreyi. Now, I'm mentioning this for 2 reasons. Number 1, it's Haemophilus. Number 2, it's going to be similar to a disease we see commonly in the U.S. Chancroid, we do not. It's a disease of the tropics. But it was brought back to this country by some of our military personnel. And you can see these gram-negative rods. And the way it's transmitted is by direct contact, and that contact is horizontal. And what I'm referring to is sexually transmitted. So this is a sexual transmission. Now, Chancroid gets its name because with the big sign and symptom of this disease, when it's producing disease by direct action and invading tissue, is going to be the formation of a soft chancre. That's an open, painful lesion. Now, I'm mentioning this because in the next chapter, the first disease we're going to talk about produces a hard chancre, not a soft one. Now, with the soft chancre, it's an open sore and it hurts, and it'll be at the site of the sexual contact. So you can see it here on the penis, you can see it here on the scrotum, and you can even see it on the labia. So this is a very open sore and it hurts, and any contact with this will transmit it. That's why we need to use barriers. Using a condom will prevent transmission because the organisms will not move through that barrier. Treatment will be antibiotics, but again, we need to use barriers when we're performing any sexual activity. Diseases produced by the gram-negative coccus can be much more serious, with the exception of bubonic plague, than the other bacillus diseases that we've looked at. The first of those is gonorrhea. Now, gonorrhea gets its name because gono means seed, rhea means discharge, and you'll see where that name comes from in a moment. Now, the organism that causes this is Neisseria gonorrhoeae. You can see that spelling. Don't worry about that because you remember what I said earlier, that in this exam 4, if you have to spell any names, I'll provide the spellings for you so you won't have that issue. Now, this organism is a gram-negative coccus, and they are in pairs. What you're seeing here is a pap smear of an infected woman, and you can see the diplococcus, and sometimes these are called gonococcus because they produce gonorrhea. Transmission of this disease can be in 2 ways, but the main way that we see it is through direct contact that is sexual. Now, it can also be transmitted by contact that's other than sexual later on when it becomes systemic, and it can also be transmitted vertically when a woman gives birth. And when we look at the pathogenesis, it will be direct action, and with this, we've got to treat it with antibiotics. Now, the big thing here is that it will get onto the mucous membranes. It has to have that moist environment to invade the body. So these organisms do not survive outside of the body very long. They dry up. That's why you're not going to get gonorrhea from a toilet seat. It has to come from another individual. The other big problem, though, as you see here, it doesn't stay localized. It wants to move, and it will go throughout the body. The difference is when we're looking at these moving, they use the bloodstream rather than the lymphatic system. The bacillus use the lymphatic system, the coccus don't. They go for blood. Now, with these, they're going to have to be treated with antibiotics because they're there, and if we don't, they will move. They will become systemic. So keep that in mind. Antibiotics are a must. With gonorrhea, the big sign and symptom for men is going to be what we call pyuria. Now, py means pus, urea means condition of the urine. So you're going to be urinating pus. Now, that's because these bacteria are going to be just invading the urethra, and in males, it hurts. It's going to produce a burning sensation when they urinate, and you will see this pus coming out. Now, when this originally happened, this was thought to be semen, seed. So hence the name gono, seed, rhea, discharge. That's where the name came from. Now, men have this symptom. Women do not. In females, 85% of the cases are asymptomatic. So ladies, you don't even know you have it. You won't know you have it until it starts moving. And by then, it gets very dangerous. The only way you're going to know that you have it is if the person that gave it to you tells you. Now, when this thing starts to move and become systemic, we will see the symptoms show up, and you can see that here with the lesions on the cervix. So as it moves through the vagina to the uterus and it gets into the neck of the uterus, it starts to invade, and you can see those horrendous lesions, and it's going to hurt. The problem is, ladies, I'm not trying to be sexist, but you are women, and you can handle pain. And because of that, you'll let this go. Men, if they had any pain like this, we're such babies, we would be at the doctor in a second. But you handle it and you let it go. And the problem is, it's going to continue to move, and it's going to spread throughout the body, and it becomes life-threatening, or it's at least going to cause you to lose a lot of your organs, and maybe all of the reproductive organs. Now, when we look at this becoming systemic, one of the big areas it goes to is the joints. And you see the severe swelling of the joints and severe arthritis. And that's also going to lead to another form of transmission. Secondary skin infections will develop from this as the organisms, when they get into the joints, start to erupt through the skin. And that's a huge problem. Because now as it comes out through the skin, if there's any contact with the moist membrane, this can be transmitted. So it doesn't have to be transmitted sexually anymore. The other big thing that we'll see as a complication will be PID. And ladies, this is when it keeps traveling. It's going to go through the cervix, through the uterus, through the fallopian tubes to the ovaries. And that's what pelvic inflammatory disease is. Now looking here, you can see each ovary covered in white pus. You can see the uterus, which is the red organ in the middle, covered in white pus. And that's huge, because when this happens, exenteration is what we're going to have to do, which is surgical removal of all of the organs. Now, why? Because, as you can see here, it will start to become necrotic. So once this happens, all of the reproductive organs are going to have to be removed. Now, the other big issue is if it is transmitted from the skin to the eyes. Now, this can happen in newborns, okay? We don't call it gonococcal ophthalmia in newborns. We call it ophthalmia neonatorum, and you'll see that in my notes. Now, that's what happens when this is passed with a mother that has gonorrhea to a child during birth. And that will happen during natural childbirth. So that's why women that have gonorrhea, we give them a C-section. Now, this can be transmitted to adults by contact with things like on the skin, but to let it get as bad as what you're going to see here, there's no reason for that. If you start to develop pink eye, treat it with antibiotics and it will respond. Otherwise, this is one of the #1 causes of curable blindness in the world, because you can see it's going to eat right through the eye, and it is nasty. And this will happen to children born to mothers with this as well. Now, that's why in the old days we used to open the eyes, put in 2 drops of silver nitrate to each child's eye. Today they use ophthalmic antibiotics, but they do the same thing. They open the eyes and squirt the antibiotics in to keep this disease from happening. Meningitis is a very serious disease produced by 3 different bacteria. We're going to talk about all of them here. 2 of them we've already discussed. The third one is the scary one. Now, when it comes to this disease, the first cause is Haemophilus influenza, which we just discussed earlier. This is the one that's going to be seen in children. So it's going to go from the oral cavity through the bloodstream, okay, and it's actually through the lymphatic system to the brain. And we'll see this primarily in children under 5. and as it gets into the meninges surrounding the brain, it will swell up, produce severe pressure on the brain, which leads to death. Now, again, this is why I recommend getting the vaccine, especially if those children are in daycare. Now, Haemophilus influenza is also going to produce a very nasty complication, just like the last one we're going to talk about, so we'll come back to that one. The next one is Streptococcus pneumonia. Now, this is the one that's part of our normal flora in the upper respiratory tract. As long as it stays there, it doesn't hurt you. But if it moves to the meninges, we've got a serious problem. In the meninges, it's going to produce meningitis, and this one has a capsule, so it's very difficult to remove. Okay, we already know that. But it's going to be the cause of individual cases in adults. So non-epidemic forms. So when we see individual cases of meningitis, it's Streptococcus pneumonia that does it. Now, the most serious of all is Neisseria meningitidis, which is a cousin of the cause of gonorrhea. Now, this one is going to be a Diplococcus, but where we're seeing it now is in the cerebrospinal fluid. We're not going to see it anywhere else. Now, it gets into the cerebrospinal fluid by being passed through the air. You inhale it. It gets into the mucous membranes of the mouth. It invades that tissue, gets into the blood, and is carried to the meninges. There, it's going to grow on the meninges. And it is a very nasty organism that will be seen primarily in adults living in close quarters. We're talking about people in college dormitories, military barracks, and even prisons. Now, we're going to talk about this disease in college dormitories later on, so keep that in mind. Now, the disease itself is going to be spread, as I said, through indirect contact, and those aerosols you inhale, the organisms now are going to start invading tissue. And the big area is when it gets to the meninges, because the big sign and symptom we're going to see with this is all the pus it produces as these meninges are being digested. Now, once it gets into the meninges, you can see here all the exudate. This is all that white is pus building up on the brain. Now, for signs and symptoms, it's really scary because there aren't many. The first sign and symptom we're going to have, you're going to have malaise. You're going to be achy, okay? You're going to have a fever. Well, all of those are things we relate to other diseases like the flu. That's why I get really offended when I watch these stupid commercials where some lawyer comes on and says, "Did your child get misdiagnosed with meningitis?" It's the hardest disease to figure out. The only way you know that somebody has meningitis is to do a lumbar puncture, a spinal tap, and remove cerebrospinal fluid and look for the bacteria. And even if you saw them, it won't matter because that person's probably going to die. And you'll see why in just a moment. Now, the second signs and symptoms of this disease, convulsions, coma, and death. Now, some cases you'll have pain in the base of the neck. Some cases the chin will droop, but those are rare. They don't happen very often. So there's no way really to identify this until people start dying. And to be honest about this, that's what happened at the University of Illinois about 7 years ago. We had 2 adults that got this disease. It was about 2 or 3 o'clock in the afternoon when both had gone to the medical facilities on the campus. They told their symptoms. They were told they probably had the flu, but they didn't feel better, come back tomorrow. Well, both died later that night. That's how fast this disease kills. So let's say that they said, "Oh, you've got meningitis," and they started giving them antibiotics. Well, we know antibiotics do not work in a matter of hours. They take days. So these organisms would have still killed them. And that's why the way we actually treat this disease, we do use antibiotics, but we give them to people exposed to this because we try to keep it from going any further. But this is a very dangerous disease, especially with the complication that can produce from a gram-negative organism. The big complication from meningitis is what we call the Waterhouse-Friderichsen syndrome. Now, this will only occur when the cause is Neisseria meningitidis or if it is Haemophilus influenza, because both are gram-negative. Now, this complication comes from the release of the endotoxin. It's a huge problem, especially with Neisseria. Neisseria often becomes an L form, and if you remember back to chapter 10, L forms lose their cell wall. So they will slough off their wall, and that means the endotoxin is being released. Now, that endotoxin is going to cause the blood vessels to dilate, which means blood leaks out and collects under the skin, forming these big blotches called purpura. It will also cause blood pressure to drop and fever to go up. So not only are we seeing the brain being compressed by the swollen meninges, but now we're seeing endotoxic shock. Now, with this disease, when it's released, with this complication, when this toxin is released, it's going to get worse and worse as it goes. And you can see how horrific it can be. Now, remember, this can happen with both forms of the gram-negative bacteria that produce this disease. So that's Haemophilus as well as Neisseria. And you can see why this is so deadly. Now, go back over these diseases. When we have our meeting on Tuesday, we'll finish up this chapter. And if you have any questions on any of this, please write them down and ask me, because this will be the material on your quiz this week and on the next exam.